Senator McSally.
Thank you, Chairman Collins. I want to echo Senator Scott's comments about your leadership and your passion for our seniors, for our small businesses, and your leadership in this unprecedented challenge. So thank you. And thank you for this important hearing. And to our witnesses for their testimony. In Arizona, as of last night, there have been 747 deaths related to the coronavirus, from the coronavirus, and 593 are over the age of 65. So that's about 79%. And as I think about this, this is a cruel virus, as we all know. And it's the cruelest to our most vulnerable. And this is the greatest generation we're talking about. This is our opportunity as we learn more about the virus. We didn't know a lot about it, but as we're learning more about it, for us to do everything we can to protect the greatest generation. This is our generation's opportunity to give back to them. And there's been an important focus on nursing homes for the vulnerable who are in these congregate settings. But we also need to think about those in memory care, those in assisted living, those who are older but in independent living. My mom's 85. She's in good health for her age. She's in independent living, but she also has been isolated for now 2 months because she's just as vulnerable as others from this cruel disease. And I've neighbors and constituents who are sharing their stories of their loved ones who are in these settings. And we need to make sure that we protect them. As I think about going forward, and it's not a choice of are we going to continue to protect lives or allow people to safely return to work. As we move forward, we can do both. But for seniors in congregate settings, we need to put a moat around them. We need to ensure that we have high levels of situational awareness, that anybody who goes to work there or support there or at some point visit there, that we know that they're not inadvertently bringing the virus in with them. We now know, unlike several months ago, that people can asymptomatically be carrying the virus. So checking temperatures is not enough. So I thank you for the testimony today, but I want to look more broadly for all congregate settings. One of the challenges we have is where there's oversight of our nursing homes in Arizona, oversight from HHS, oversight at the state and county level, the independent living, the assisted living, they are usually private entities. And so they're trying to get PPE, trying to get testing. It's not an easy top-down thing to do with the supply chains. We've had many innovations in Arizona. One company I visited, AmSafe, used to make seatbelts and airbags for airplanes. They just started making masks and gowns to support our nursing homes in Arizona. It's just an incredible story. More of that needs to happen. We need to bring the PPP manufacturing home. But I want to ask, Dr. Konecka, can you share broadly, if we're looking at all seniors in these congregate settings, what does it look like for us to keep that moat around them? I think it is our testing needs to be focused on staff and ideally visitors and others who are going to go in there, and high levels of situational awareness, plus the controls that we've learned to isolate and be able to treat quickly. But what does that look like, not just for nursing homes, but for everyone who's in this vulnerable category in a congregate setting?
First, thank you very much for that question, because I think there's a tendency to focus only on nursing homes. And in many states, assisted living facilities look very much like nursing homes in terms of the level of care needed and provided and the vulnerability of the residents. And yet, because assisted living facilities are licensed by states and don't receive generally a lot of Medicaid or Medicare funding, we sort of tend to ignore them in these situations. And yet they're completely just as vulnerable. So I think your question about the social isolation in these settings, not just assisted living, but also independent living, is a huge challenge. So I think, in the riskiest time when we have to prohibit visitors, some things can be done in the meantime, like making sure that these facilities have appropriate technology so that residents can at least communicate through FaceTime or other video chats with their families on a regular basis. In the longer run, I think it's essential for all the reasons that you and others have mentioned that we do worry about the social isolation and start allowing visitors. And that's one of those things that I think we'll learn as we go in terms of how much is too much. But that balance has to be struck. We have to limit that social isolation even as we try to stem the virus.
And thank you. I know I'm over my time, but I also want to say this isolation, I've heard cruel story after cruel story. The virus is cruel, of people fighting for their lives alone, and the amazing nurses who are with them, but not with their loved ones and family members. People taking their last breath alone without their loved ones and family members, not being able to even be there for their funeral. We've got to be able to focus on allowing people, when we can, as quickly as possible, to be with their loved ones safely during these times so that they can be there. It's impactful not just for the senior, but also for the other family members who feel helpless. And so all working together, we've got to address this issue to allow people to safely be able to visit at the right time. Thank you. Thank you, Madam Chair. Thank you for your grace.
Thank you, Senator.